As a pediatrician, I think we are the ones who are the most worried when we have the sick children coming to us. And I'd just like to highlight a few things about air pollution and child health. Everyone, I think you would be surprised, or maybe you already know that 90% of the children below 15 years of age, as per the WHO, breathe toxic air on a daily basis. And this translates to about 1.8 billion children who are at increased health risk, and many of them do die. 2016 data said that 6 lakhs children die annually due to air pollution related lower respiratory tract infections. In India also, the situation is very bad. We have about 18 lakhs people who die annually from air pollution related illnesses. And of these, approximately 67,000 are children. Probably the figures are higher than 67,000, looking at the kind of patients that we are getting in the last few years. Now, as someone has already highlighted, I think Shweta and someone else has already said that the effects of air pollution starts very early. And it starts when the babies are inside the mother's womb, because the inhaled pollutants from the mothers transfer to the baby. And we are seeing the effects of that in the form of a lot of low birth weight babies being born, many premature deliveries being delivered in India, and some of the women even have stillbirths. In fact, we are the country with the highest amount of low birth weight and premature babies currently in the world. And later on, the continued exposure to the polluted air leads to neurodevelopmental effects in the form of low IQ scores, low memory, decreased ability to perform logical thinking. We see a lot of autistic children and attention deficit children, anxiety and depression. And the same children, when they become adults, it is said that they would have early dementia and Alzheimer's. They also trigger the respiratory system to cause more bronchial asthma and pneumonias, and this has been our experience. And particularly in Guwahati, in Assam, in the last 1 month, we've had an exponential increase in the number of children from about 1 to 7, 8 years of age who have been admitted with various kinds of pollution-related asthma and pneumonias. Now, these children are also at risk for cardiovascular disease, diabetes, and obesity, which are caused by certain pollutants which are inhaled from the air. Interestingly, I just went through a study recently from the Journal of Environmental Economics and Management, where they stated that if we could reduce the pollution level in our country to the ones which are suggested by WHO, that means an 8-fold reduction in the PM10 and PM2.5 levels, it will reduce stunting by 10% and severe stunting in these children by 5%, which in actual figures is about 14 million children who will be less stunted. Now, studies in Delhi, which were done by Lung Care Foundation and some other organizations, have also shown us that there is a high number of children who get respiratory illnesses when you compare them with the children coming from rural areas. Another important fact which people miss, and I think it's time that we highlight, and we've also been doing it in our day-to-day practice, is the impact of indoor pollution. Because when we talk of air pollution as such, people think it's only about outdoor pollution, but the indoor pollution in our country is a big contributor to respiratory health in children, because of the fact that they're still using, in spite of the government encouraging the use of liquefied petroleum gas, people are still using wood as a fuel source. And these kitchens are very ill ventilated, and the babies are always there with the mothers. And so they get exposed for a longer time and to a higher degree of pollution. There are studies which have also shown that there is a lot of restriction of the lung function in children who are living in cities like Delhi. We have not had studies done here, but we are planning a study with Lung Care Foundation to look at this kind of an effect in the city of Guwahati and nearby areas. Now, the question which is most pertinent is, why are children more affected than adults? I think you all know that as in adults, we breathe at the rate of 15 breaths per minute and take in about 11,000 liters of air daily. In children, at an average, the breathing rate is double that of an adult. So they breathe at around 30 to 40 breaths per minute, and imagine the amount of air they're breathing in compared to adults. And so a higher exposure and a longer exposure leading to both acute and chronic problems. As a clean air champion associated with the Lung Care Foundation, it has been my privilege to be a part of a group which we created just before the pandemic. quality and its health hazards via print, TV, and social media. And also regular tree plantation efforts are done by our members. We have also launched the City Action Group with people from diverse backgrounds to create awareness and spread the message. And I am also happy to be associated with the WHO's Breathe Life campaign for creating awareness at individual and public level. There is a long way to go, but these baby steps are slowly and steadily making changes in the people's mindset, especially the children, where many of my patients are now regular users of masks. They refuse to burst crackers. And many of my patients, as well as the parents, have learned how to use the AQI app, and they talk about AQI when they talk about air quality. So I think these are very, very small steps in the right direction. And I hope that in the days to come, we will be, doing more in association with an excellent organization like Lung Care Foundation. Thank you so much.